Hi, I'm Crystal. I am the manager of radiation oncology, and y'all are here for Radiation 101. So today, some of the topics we're going to discuss is some general issues and concerns, and your expectations for treatment, and a brief review of some of the equipment that we have in our department. If you don't already have these slides, you can ask for these at any point in our department, and we will supply you with them. Our goals for today are to clarify some expectations that you have, ensure that you understand the care that you're going to be receiving with us, to give you some insight into the technical aspects of your care, introduce you into some of the professionals that are involved, whether you're going to actually meet them or not, and then hopefully answer any questions that you've got. All right, so this is a map of the first floor of the Cancer Center. In the folder that we can provide you, there's actually a map of all 4 floors. In radiation oncology, we have 5 radiation oncologists, 2 physician assistants. We've also got 5 faculty medical physicists and 2 medical physicist residents. We always have a first year and a second year resident. All right, so in radiation oncology, we've got 12 radiation therapists. These are the people that actually deliver the radiation every day, so these are the faces you are going to see on a daily basis. There's a ton of them, and you will see most of them throughout your treatment. All right, we've got 6 nurses. Each physician has their own nurse, and then we have a float nurse that can fill in at any point if needed. All right, these 3 people are our dosimetrists. These are the 3 people that actually do the treatment planning. You probably will never see these people. They are behind the scenes, behind a computer most of the time. Once you have your CT simulation, that goes into dosimetry, and these people actually do the treatment plan with the physician and the physicist. These 2 ladies here are the CT techs. They are not radiation therapists. They are not trained to deliver treatment. The only thing they do is our CT scans for the treatment. All right, these 4 ladies here, a variety of people. They are secretaries, billing specialists, pre-authorization, medical records, a variety of different things like that. They're available for you at any point if you need any assistance. All right, support services. This is located on the 4th floor. They're available to all of our patients. We have a dietitian. She works on patient referral, physician referral. And if you need her assistance, don't hesitate to ask your physician. Social services work with several of the foundations locally to assist our patients in a variety of different things, be it lodging, gas cards, that kind of thing. They are available to everyone. All you gotta do is contact them. Their contact information is also in that folder that you can receive in our department. All right. Radiation oncology specifically is dually accredited. All that means is these 2 societies say, hey, to be a top-of-the-notch radiation oncology department, you need to do X, Y, and Z. We do that. They come and check to make sure we do that, and then they give us accreditation. We also are part of the medical physics residency program. All this means is that medical physicists from across the world come and compete to train here. We always have, like I said, a first year and a second year. Once the second year person is done, they are ready to be a medical physicist. We also have physicians from the medical school at LSU. They come and follow our doctors around to see what it's like to be a radiation oncologist. We also have radiation therapy students. These students are training to be actual radiation therapists, so they are actively involved with your care, and we'll talk a little bit more about that in a minute. And we also have X-ray students that come through from Northwestern and Southern, and these students are rotating through just to kind of see what radiation therapy is all about. All right, and I will turn this over to Nick.
Hi, I'm Nick. I'm a medical physics resident here. I'm the second year medical physics resident, as Crystal was talking about, as part of our medical physics residency program here at Willis-Knighton. And we're going to talk about some of the technical aspects of your care and then go through the overall flow of care that you're going to receive in this department. So medical physicists are physicists that have received graduate training in medical physics, which is applying physical principles to medicine. So in radiation therapy, we can specialize in the treatment of different diseases using radiation therapy. The chief job that we have is to ensure precise, safe therapy every time you come into our department. This typically means taking a lot of measurements. We develop programs, different ways of treating patients, and then we also refine those different techniques every day in our department. We work to be better. We use our scientific skill set to assist us in doing so. And we help other members on the team in the department through consulting with them to find out solutions to different problems that we encounter. We do research and development in many different areas, some of them more technical, some of them more clinical. We also do teaching. So the radiation therapy students that Crystal was talking about a moment ago, we may assist in teaching them about different principles that physics does. And we also do things like teach this class. I have a couple of slides on the history of radiation therapy, or a few slides. I want to talk about around 1900, that's when X-rays were first discovered. William Röntgen discovered X-rays because he was the first person to be able to describe them. And quickly they were used in medicine. So what made that possible was around this time, Marie Curie discovered that a rock called radium exhibited these properties. It was radioactive. And so electricity wasn't prevalent these times. They were able to crush up radium, make that into a salve, and treat superficial diseases. That also made it very possible to use. Another, it was sort of a snake oil of the time. You have radium suppositories, radium gum. And so while these sorts of uses quickly fell out of favor, remember X-rays were discovered in 1900, in 1905, 1910, it's quickly reaching maturity in medicine. In World War I, there were trucks that drove around the battlefield that could take X-rays of casualties and help the surgeons make the first cut. So very quickly, radiation found a stronghold in medicine and became a very powerful enabler to clinicians. In the 50s, you have the development, the first generation of the technology that we have in our department today. This is a linear accelerator on the left, and this is a cyclotron on the right. On the left is the machine that we use to deliver X-ray therapy and electron therapy. On the right, that's for proton therapy. In the 1970s, CT and MRI were developed. Those are very important to the way that therapy is delivered today, and you'll see why in a moment. So, before I showed you the first generation of linear accelerators, this is the technology that we have in our department. On the right is an Electa Versa HD. On the left is the tomotherapy HD. Both of these are the latest generation of their technology. Both of them are capable of taking images at the treatment machine. So we can do a CAT scan at the machine to make sure that the treatment is very precise and everything is positioned correctly. I call them electric machines because therapy is only delivered when the beam is switched on. Nothing in these machines is radioactive, meaning nothing is going to be delivering treatment without someone deliberately pushing a button. I have here pictures of the ways that we treat, shape the radiation. So X-ray radiation is light. Just like visible light, you can shape it, only it's more energetic. So we have thicker blocks that we shape the radiation with. What I have pictured on the right here is what is actually in the machine on the left right here. So the dosimetrists that Crystal showed you earlier, Chris, Megan, and Joe, they are going to develop fields, we call them, individual treatment fields that are shaped precisely to where the physician wants to deliver treatment. Those fields are shaped using the collimators in this head, and all that information is controlled digitally from the treatment planning software to the treatment machine so that everything is safe and precise and specific for your individual disease. If we're treating with electrons, this device may be used, which we call an electron cone. This is doing the same job as the other collimators we just spoke about, only electrons scatter in the air, so it's important that we shape the beam as far as we can to make the treatment precise. The cyclotron that we have in our department is pictured on the right. It's about the size of a car, whereas the cyclotron I showed you from the 50s is about the size of a small house. The cyclotron will produce energetic protons that will then go down a beam line, and then in the treatment room come from what we call the nozzle and treat the disease as indicated. We can also do X-ray and CT or CAT scans at the machine and for precise positioning of the patient before treatment. Earlier I talked about radium. So while we don't use radium in our department, typically we have a different kind of radioactive source called iridium. So it is a radioactive source about the size of a grain of rice. So imagine a radioactive grain of rice welded to the end of a steel wire. That device is controlled by this here. The radioactive source is stored in this device. When it's time for treatment, it's extended on that steel cable down a tube, and then it stops wherever we tell it to. What we have pictured here is our QA device in the morning. So we have a camera here that allows us to verify exactly where that source is going. So for instance, in 2019, we wouldn't give you a radium salve. We might use something like what is here, pictured here on the right, top right part of the screen, to treat a superficial or a skin disease. And so we would connect a tube, the same tube I showed you here, to the end of this, and that seed would go down and stop right here. A physicist would calculate how long that needs to stay there to deliver the prescription dose that the physician prescribes. And then after the treatment is done, it's retracted back into this device. There are several ways that we make sure that the source is safely returned to the device. This device here stores the radiation safely enough to where you could live in this room as a non-radiation worker and never come close to your annual limit. So it is a radioactive device inside of this shielded area here. However, it is very safe. A lot of what physics does, like I said, is take measurements. We have a very carefully designed quality assurance program to make sure that if you come in and you're the first patient in the morning or the first patient after lunch, or you happen to come into our facility on a weekend, every time the beam is turned on, it's safe, accurate, and precise. And so we measure all things. Beam quality, meaning what does the radiation actually look like, the imaging at the machine, the CAT scan or the X-ray images that we may take, all the mechanical equipment in the room, all the safety equipment, all of that is checked by different members of our team on regular intervals. We use radiation because it's precise. We can shape it to treat exactly what the physician would like to treat, and it's penetrating. And so how it works is when it does penetrate, it can damage the cells. And how we talk about the damage of the cells is to the DNA. When a cell is getting ready to divide, it needs a set of instructions. And the set of instructions is what we call the DNA. And when the DNA is damaged, when it reads it, it is unsuccessful in performing that duplication. So cancer cells tend to duplicate much quicker than healthy cells surrounding it. So they're more sensitive to the radiation present. The idea is to deliver a small dose of radiation every day over a period of weeks, such that the cancer and the tumor shrinks over time and the healthy cells have a chance to bounce back and repair themselves. So now I'm not going to talk anything about technical details from here. We're going to talk about the patient flow as you've come into our center. So the first day that you met with a physician, we call that a consult. So you met with a physician and spoke about your disease, and the physician and you came up with a plan. And so now that you have a plan, you're going to come back for what we call a simulation or a marking session. We call it a simulation because it allows us to simulate different ways of treating your disease to come up with the best plan possible. Crystal showed you a picture earlier of Megan, Joe, and Chris, and that is what they're going to do. When you come for the CT simulation, the first step is to position the treatment area such that it's very stable. Depending on the treatment area, there may be a different device that's used. It all depends on where we're treating. So on the leftmost part of the screen, you see a mask. That's used for treating a head and neck area. So that allows us to keep your head and neck stable. In the middle, we have what is essentially a bean bag that once you're laying on top of it, we suck all the air out so that it remains in the same position. So that when you come back to our department, it helps you get back in the same position the next time you're here. On the right is a device that allows ladies that are receiving treatment for breast cancer to get in the same position every day. And those bars you see there are so that they can reach up and grab and hold on to them to keep their arms out of the treatment fields. So depending on what we're treating, where we're treating, the therapist and the CT technologist and the physician, the dosimetrist and the physician may come up with different ways of positioning you during that CAT scan session. Once you're positioned and everything is stable, there's a set of lasers in the room that we will mark on your skin with markers. It's very rare, but sometimes we'll use a small tattoo the size of a freckle to mark that spot. Those laser marks are important because there's a similar set of lasers in the treatment rooms that allow us to get the patient to a point where we can begin taking images for pre-positioning. So the lasers get us really close, and then the X-ray or CT at the machine helps us refine that further. We may place BBs on the skin at the place of those where the X-rays are marked. The only reason those BBs are there are so that on the CAT scan we can see where those work, because that's important to us. You don't need to have those BBs on your skin after the images are taken. You can take those BBs off. So what I've shown you here is an example of a slice from a CT of a patient that's coming to our department for proton therapy of the prostate. What I've pictured on the right are our MR simulator, our MRI, and our CAT scan or CT in our department. The CAT scan that you receive here isn't going to be any different than any other CT you've received before, except for the table in that room is flat where others are curved, and there's those lasers I spoke about a second ago that help us begin positioning. The MRI is also in our department right across the hall if you have an MRI while you're here. So we're going to take that image I showed you of a patient about to undergo proton therapy for the prostate, and we're going to go through the process with those images, just as we would for any other patient. So once we have those images, we can begin the treatment planning. And again, the reason why we call it a simulation or a CT sim is because it allows us to simulate your treatment. Without you being here, without you being at the machine, we can do all that in our state-of-the-art technology and our software here at Willis-Knighton. So the first step on these images is to identify the areas we want to treat and the areas that we do not want to treat. So what I've shown you here is exactly that after it's been done by the physician and the dosimetrist. So the prostate and the lymph node beds are the areas the physician has decided that he or she wants to treat here. And then we have the bladder and the rectum. Those are areas that are healthy, normal structures that we don't want to treat. After those areas have been identified, the next step is the simulation. So in the software, we can simulate different treatment designs to come up with the best treatment plan possible. What I have here is the same image before, but with radiation dose simulated on it, where red is higher dose regions and blue is cooler, lower dose regions. So the dosimetrist and the physician will go back and forth until they've come up with the best plan possible and they agree on that. After that is done, the next step is chart review. So the chart then goes to the physician again for signature, the chief therapist, or Crystal, the radiation oncology department manager, and a physicist. Everyone has to sign the treatment plan before we can proceed. Once everything has been signed, treatment delivery can begin. So you will be in our department for the CT simulation or marking session. You won't come back to our department until it's time to deliver the treatment. When you're here for treatment, Crystal's going to go through all of the steps that you might expect every day. But more generally, there's always 3 steps. Immobilization. What I mean by that is putting on your mask, getting on that bean bag, those things we talked about before. Positioning, That's always going to be starting with the lasers. And then after you're close with the lasers, we can take further images at the machine and further refine that positioning. After the therapist or the physician, if they're at the machine as well, are comfortable with the positioning, then they'll deliver the treatment, and not before. So Crystal is going to go through your first day expectations.
All right, so I'm going to talk about what you're going to deal with every day. I've been a therapist for 15 years, so most of what I've put on these slides is things that I've encountered with patients and things that the current therapists have encountered with patients to hopefully try to get rid of some of the questions that come up on a regular basis. So to start off with, where to go? Where are you supposed to go? So the first thing you're going to do is scan your barcode. You're given a barcode when you come for your CT simulation. This barcode is white. It has our physician name on it, and it has a barcode with your name on it. That is the one that you're going to use for us. If you are having something else done within this building on a different floor, you might be given a barcode that is pretty and colorful with a different picture on it, also has your name on it, but that one is for upstairs only. That one will not work for us, and we won't know that you're checked in if you use that one in our department. So when you come here for radiation, you're going to scan the white barcode with our doctor's name on it. That's going to let us know that you're here. As soon as you've done that, then you're going to proceed on to the dressing room. You're going to get undressed into your robe or your gown, just like you did for your CT simulation. If you have any questions on how to undress, you'll just ask someone, be it a therapist or someone that's helped you get back to the dressing room. Once you get undressed, you're going to put your stuff in the lockers. There are lockers available in all the dressing rooms. There's keys in each locker. You can put your stuff in the locker, lock it up, bring the key with you. After your treatment, you're going to get your stuff out of the locker and leave the key in the locker for the next person to use. We also ask that when you come back to the waiting room, the seating is pretty limited. So we ask that it be patients only unless you need some assistance. If you need assistance getting back to the dressing room or getting changed, dressed and undressed, then someone is more than welcome to accompany you back to the dressing room. We also have a rule that no children under the age of 18 are allowed back in the dressing room. All right, moving on to what to wear. So 90% of our patients change into a gown or a robe. You're going to do this every single day that you come for treatment. So easy to remove clothing is the best choice. Also, a lot of our patients have to remove their shoes for treatment every day. We also ask that you wear slip-on shoes or easy to remove shoes so that you can do that fairly quickly without any struggles. No jewelry in the area that we're treating. For example, if we are treating the head and neck region, we don't want any necklaces, earrings, that sort of thing. If we're treating a head, same concept, no necklace, no earrings. All right, when to arrive. So most of the time our machines run on time, if not ahead of schedule. So we ask that our patients are here, undressed, ready to go at their appointment time. We prefer to stay on schedule. And if our patients arrive, just say at their appointment time, and then they have to get undressed, it pushes us behind schedule. Our appointment times are around 10 minutes. So if it takes you 5 minutes to get undressed and then 10 minutes to treat you, then we would be behind schedule. So we ask that everyone's here, ready to go at their appointment time. With that being said, if you're an early bird, that's perfectly fine. We love for our patients to get here early. They will not make you wait. If they are running ahead of schedule and you are the next available patient to treat, then they will go ahead and treat you. They're not going to make you wait until your appointment time. However, if you're an afternoon patient, don't just show up in the morning. That's a little too early for us. We like for you to let us know that kind of stuff ahead of time. All right, comfort issues. I'm sure everyone's known by now since you've been here once that it's cold in this building. It is cold everywhere in this building. It is colder in the treatment rooms. The treatment rooms are kept somewhere around 66 degrees. So if you are a cold-natured person, you are more than welcome to bring a light throw from the house with you. The therapist will try to keep you covered as best they can. There are some situations where we can't cover the area we're treating. For example, a breast patient, we have to see the breast that we're treating, so we cannot cover that area. We will cover from, the stomach down to try to keep a patient as warm as possible. We do have a variety of male and female therapists. There's a pretty even amount of both, so you will get a combination of those while you're under treatment. They are all professionals. They're used to treating every disease site possible all the time. They will try to keep your modesty in mind as much as possible. Like I said earlier, we have therapy students and x-ray students. The therapy students will be actively involved in your treatments. They will be lining you up. They will be doing the imaging. They will be helping to deliver the treatment, all while supervised directly by a staff therapist. They're not allowed to do anything without a staff therapist with them. The x-ray students, however, majority of them are observing only. They don't necessarily get involved too much with the patient's leveling and treatment. There are occasions where these students are super interested in therapy, so they will get more involved, and we allow them to under the direct supervision of a staff therapist as well. All right, your first day of treatment is always longer than any other day that we are going to do. The reason behind this is we have to take images of everything that we are going to treat. Every day we take images to make sure you're perfectly lined up, but on that first day we do those images along with images of every single field that we are going to treat. We also have to call the physician over to verify these fields. Sometimes that takes a little longer than we would like. If they are with a consult, it takes them a little bit of time to come out of that room and get to the machine. Once they have verified that, we put new marks on you, we take photographs. These photographs don't go anywhere, they don't go on the internet or anything, they go in your chart. These are just to document what we have done this day. We have to document everything that we do in our department, and this is one of the ways that we do that. These appointments take anywhere from 30 to 45 minutes. That can vary just a little bit depending on the plan the doctor has prescribed for you. It can take more than 45 minutes or less than 30 minutes. It just varies depending on the patient. All right, checking in every day. So we talked about the barcode scanner. You're going to use this every single day that you come in for treatment. You're going to scan that barcode. Once you scan that barcode, you're going to go back to the dressing room, just like before. Now, if you sit there for 15 minutes past your appointment time, please let someone know. Stop anyone and ask them if you're checked in. There are rare occasions when our barcodes freak out and we have to restart them, which means they didn't scan you in. And there's occasions when the specific patient's barcode did not work, so you're not checked in. Nobody knows you're here. So if that happens and you wait 15 minutes past your appointment time, please stop and ask someone if you're checked in. They'll see if you're checked in. If you are, great. If you're not, then we will get you a new barcode or we'll get you checked in or whatever we need to do. Now, I'm sure at this point you've come for your consultation, which means you've gone through the registration process. This will not happen again while you're under treatment until the first of the next month. So if you're getting treatment during 1 month, come the first of the next month, you're going to have to stop in admitting, sign some new paperwork, and get your paperwork and stickers to the therapist. They will remind you, they'll have signs on the doors and things like that, so you don't have to remember that. This is just informational so you'll know what's going on. All right, your daily treatments take anywhere from 10 minutes to 30 minutes. All of this varies based on what machine you're on and what plan the doctor has prescribed for you. Majority of our treatments are around 10 to 15 minutes on an average. This is the time going in the room to coming out of the room. All right, Nick talked earlier about radiobiology and the importance of why we use radiation to treat cancer. It is super important to come 5 days a week, Monday through Friday. 95% of our treatments are done 5 days a week. There are rare occasions where some treatments are delivered every other day or a different type of delivery based on what the physician has prescribed. But the majority of what we treat is 5 days a week. It is super important to come every day that you are scheduled. The reason behind this is that we are not being effective if you don't come every day. If you're scheduled for Monday through Friday and you come Monday, Tuesday, and you miss Wednesday, Thursday, Friday, we're not doing what we need to do. We're not being effective. So it is super important to come every day. With that being said, we do understand that there are sicknesses, there's crazy Louisiana weather, there are different things that cause people to miss treatment. That is perfectly acceptable, but we do ask that you please, please, please call and let us know if you are going to miss treatment. If you don't show up for your appointment time, we will search you down. We are required to call every number that you have in your system to find you. Our doctors require us to find out why our patients are not at treatment. So if you don't show up, we will call and find out, so that we ask if you please miss treatment to call us and let us know so we're not searching you down. Just call, tell the secretaries who you are and that you're not feeling well or whatever's going on. We'll document that, we'll let the physician know, we'll cancel your appointment, it'll just be tacked on to the end. That lets us know that you're not coming and we don't have to track you down. For treatment appointment changes, we understand that you've got other doctor's appointments, you might have chemotherapy, you might have different things that conflict with your daily radiation appointment. It's perfectly fine. All you have to do is let us know the day before. The therapist will work with you on getting you in before your other appointment or after your other appointment, whatever works best. We do ask that you're flexible with us. We treat anywhere from 70 to 90 patients a day, so we're pretty busy. We might not have the exact time that you want to come for your treatment. So if you want, just an example, 10 o'clock time, we might have a 9:40, or we might have, just say, a 10:30. We might not have exactly 10 o'clock. If there's a specific time that you really need for work or whatever's going on, we will try to get you as close as possible for the time being until someone finishes or that time becomes available, and then we will move you to that time. Now, machines go down every once in a while. It doesn't happen very often, and it probably will not happen while you're under treatment. However, we'll talk about it just so that you're aware. We have two identical elective Versa machines that Nick talked about earlier. Since we have two of them, they're beam matched. They're identical machines. The majority of our patients can be treated on either machine. So when one of them goes down, we just move our patients over and treat everyone on the same machine. The machine going down might take 30 minutes, it might take an hour. There are occasions when it might be longer than that. On those occasions is when we'll move the patients over. We'll get everyone treated. It might cause some treatment delays. It might cause us, if you're a morning patient, to call you and ask you if you can come in the afternoon or during lunch so that we can get you in without having a long wait. Now, if you're on one of the other machines that we have in this department, we've only got one of the other ones. So if one of them goes down, sometimes it's an hour delay, a 2-hour delay. Other times if we have to order a part, the parts are shipped from out of town, sometimes out of the country. If that occurs, then the machine and those patients will be canceled for the day. That is fine, it'll be tacked on to the end of your treatments. If we're down for several days in a row, which is extremely, extremely rare, then you might be replanned on another machine for a couple of days. This is extremely rare. It does not happen very often at all. Now, our hours of operation. Our first treatment starts at 7:30. That is the earliest that we can begin. A lot of times we will move our chemotherapy patients up to the first slot of the day so that we can get them done and out of here so that when they're done with chemotherapy, they can just go home. They don't have to come back down and get their radiation. The time that we finish depends. We have one machine that finishes treatment at 11 o'clock in the morning. On that particular machine, I can't allow them to have a patient at 4 o'clock. That's several hours of them just hanging out doing nothing. So if you were told that you can only come in the morning on that particular machine, that's my fault, not theirs, because I can't have them just sitting around. Now, with that being said, the majority of our machines treat until 4:30. Pretty available if needed. All you have to do is ask. Holiday closures. We are closed for the major holidays. We don't get all the fancy ones that the government gets. So next big holiday for us is, Easter, 4th of July, Labor Day, Memorial Day, Christmas, Thanksgiving, those types of things. That's about all we close for. All right, radiation side effects. In this class, we do not talk about specific side effects because each patient is different. So even though two patients might have the exact same disease, they'll each have different side effects. So when you've come for a consultation, you should have been given a folder with a site-specific handout in it, and this handout describes the most common side effects with that particular type of treatment for that disease site. That's what we tell you to refer to because that is the most common things. Not necessarily saying you're going to have those things, that's just the most common ones that occur. So the one thing that we'll say in this class is we only affect the area we're treating. So if you are treating head and neck and your knee starts hurting, we're not doing that. We're only affecting the area we're treating. All right, what to use on your skin? Please, please, please don't use anything on your skin that is not specifically approved by your radiation oncologist. There are lots of things that you can use that will cause worse side effects. We don't ever want that. So please make sure that you approve anything that you want to use with your radiation oncologist first before you use it. If you have any side effects, please do not hesitate to let us know so that we can deal with them, we can address them. The perfect time to do that is on-treatment visits, or what we call OTVs. These are done every Monday in our department. That is the easiest way for us to do it. We block off the doctor's schedule so they're seeing no one other than our patients that are on treatment. After your treatment, you'll get your treatment like normal. After your treatment, someone will remind you, hey, don't forget it's doctor day. Please have a seat wherever, and then someone will come get you and take you to an exam room. This is a pretty quick visit. The doctor walks in, asks you how you're doing, if you've got any problems, questions, concerns. Everything's good, then you're done. This is required every 5 treatments. We have to see our patients every 5 treatments, once in every 5 treatments. If you get to treatment number 6 and we have not seen you, we will not deliver treatment number 6 without you seeing the physician. These might occur on a different day depending on a holiday and things like that. If a holiday falls on a Monday, then our OTVs will occur on the next business day, so Tuesday. If for some reason you have chemotherapy on Mondays and you can't stay to see the doctor, you can definitely stay Tuesday or Wednesday to see the doctor. You just have to see them once within those 5 treatments. When your physician is out of town, I stated at the very beginning that we have 2 physician assistants. Those 2 ladies will see you when your physician is out of town. They are trained just like the radiation oncologist. They're trained in radiation oncology specifically, so they can answer any of your questions. They can help do medication refills that we've prescribed you if needed, and all kind of things just like the physician will. All right, so if you have any questions during treatment, the radiation therapists are your first line of defense. Those are the people that you see every day, so those are the people that we want you to ask your questions to first. A lot of times, most of them have been here for years, so a lot of times they can answer your questions or tell you if that's completely normal, or they can give you a suggestion on what to do that's over the counter to help. A lot of times they'll tell you, try this. If that doesn't work, please let us know, and then we'll get you to the doctor. There are other times when they'll say, ooh, we need to get you to the doctor or the nurse, let them talk to you about this side effect. With that being said, please wait until your treatment time or until you're called for your appointment to talk with them. When you get to our department, you'll notice they're pretty visible to all the patients. But when they're treating a patient, they're giving their attention to the patient that's on the table. So if you walk up to the machine and ask them a question while they're treating another patient, that's pulling their attention from that patient to you, which is okay, but we prefer them to give 100% of their attention to the patient that's on the table actually receiving radiation. So we ask that you wait until they call you for your appointment time before you ask your questions or want to change your appointment or anything like that. When they call you, that is your time to have them all to yourself to ask whatever you need. If you have something come up, please do not wait till Monday. Monday is your scheduled on-treatment visit day, but if something comes up, we don't want anyone to wait to ask a question or bring up a concern. All right, your final day comes up quicker than you think. On your final day, even if it happens on Tuesday and you've just seen the physician on Monday, someone is going to say goodbye to you. It could be a nurse, it could be a physician, or it could be the physician assistant. But someone's going to say goodbye to you and check up on you and see if you're okay before you walk out of our department. They're also going to give you a follow-up card. This follow-up typically occurs in 3 months. There are particular occasions when they'll bring the patient back in 1 month. However, we typically wait 3 months. The reason behind that is that radiation continues to work even after you're done with your treatments. So you can finish, that's fine, but the radiation is continuing to do its job. So we wait 3 months before we get a PET scan or lab work or MRI or CT to see how we have done. When you come back at that 3 month part, that's when they'll do that. That's when they'll tell you how we've done. That treatment barcode that we talked so much about at the beginning, that you use every single day of treatment, is no longer good. So you can throw it away whenever you're done. When you come back for your follow-up appointment, you're going to sign in up at the front and admitting, go through the paperwork process, and then someone will come get you from up there. During treatment or after treatment, if you have any questions whatsoever, please do not hesitate to call our department. Tell them who you are and what you need, and they will get you where you need to go. All right, these websites that are listed here, the first one is a really good website if you want to research anything about cancer. The second one is the Astro website, where there are patient site-specific videos. A lot of these videos were filmed here in our department with our physicians and our patients and our nurses. So if you are interested in watching a patient perspective video on certain sites, this is a good place to go to watch those.